Hi, I'm Robin Moppin, and today we're going to be talking about ovarian cancer, what every woman should know. So, a little bit about me. I'm a 23-year ovarian and uterine cancer survivor. I founded an organization 18 years ago called Oasis of Southern California. It's an ovarian cancer advocacy and support organization. And I also facilitate 2 ovarian cancer support groups every month. OASIS stands for Ovarian Awareness, Support, Involvement, and Survivorship. And it was founded in September 2002. It's an all-volunteer ovarian cancer advocacy and support organization, and we're based in Riverside. We strive to bring awareness and information to Inland Empire women and their loved ones about ovarian cancer, but we also provide support and resources for women who have been diagnosed with the disease. So some of the things we do at Oasis is we participate in health fairs in order to educate women about ovarian cancer. We also provide speakers for educational presentations for interested community and healthcare organizations. We also support state and federal legislation for research for ovarian cancer. And we provide information and resources for women who've been diagnosed with the disease. I facilitate 2 support groups every month. One is on the second Monday of the month. It's at 5:30. It's held at the Pink Ribbon Place at the Riverside Community Health Foundation on Lemon Street in Riverside. And the second one is on the third Monday of the month, held at Michelle's Place in Temecula at 6 p.m. And right now, we are holding our support groups virtually. And for more information about that, please contact Pink Ribbon Place. So today's presentation will include ovarian cancer statistics, an overview of risk factors, protective factors, and symptoms, and also what to do if ovarian cancer is suspected. So a few basics about ovarian cancer. It's the 11th most common cancer in persons born female in the US. Right now, around 200,000 individuals are living with ovarian cancer. And ovarian cancer causes more deaths than any other gynecologic cancer. It's the 5th leading cause of cancer deaths among individuals in America born with ovaries. In 2020, approximately 21,750 individuals in America will be diagnosed with ovarian cancer, and approximately 13,940 will die from it. 1 in 78 persons born female will develop ovarian cancer in their lifetime. Ovarian cancer is more prevalent between the ages of 55 and 64. However, it can and does occur in persons born female of all ages, races, and ethnicities. So awareness is very important. Early detection of ovarian cancer can be difficult. When ovarian cancer is diagnosed in stage 1, the 5-year survival rate is as high as 90%. Unfortunately, only 15% of cases are diagnosed in stage 1. 60% of patients are diagnosed in stage 3, and the overall survival rate for 5 years at this stage is 39%. One of the reasons for that is because there is no screening test for ovarian cancer, and a pap smear does not detect it. So here are some of the risk factors for ovarian cancer. Increased age, of course. Increased age is a risk factor for most cancers. Another one is a personal or family history of certain cancers like breast, ovarian, uterine, or colorectal. Also, certain genetic mutations put you at higher risk, including the BRCA1 and 2 mutation and also Lynch syndrome. Ashkenazi Jewish descent also puts a person at higher risk for ovarian cancer. Hormone replacement therapy is another risk factor. The more menstrual cycles a woman has, puts her at higher risk for ovarian cancer. Obesity is also a risk factor. And endometriosis is another risk factor for ovarian cancer. So the good news is that there are also some protective factors. Here are some of them. Removal of the ovaries or fallopian tubes lowers your risk for ovarian cancer. Childbearing also lowers your risk for ovarian cancer. Breastfeeding also lowers your risk. The reason for that is because there is less ovulation, and that lowers your risk for ovarian cancer. Oral contraceptive use is another way to lower your risk of ovarian cancer. The other one is tubal ligation. That's another way to lower a risk. So it's really important to know what the symptoms are. Now, these are 4 symptoms that are probably the most common symptoms for ovarian cancer: bloating, urinary frequency and or urgency, pelvic or abdominal pain, and difficulty eating or feeling full quickly. Studies have shown that these symptoms are much more likely to occur in individuals with ovarian cancer than persons born female in the general population. But there are also some less common symptoms of ovarian cancer. These have been commonly reported by women. However, these other symptoms are not as useful in identifying ovarian cancer because they're also found in equal frequency in women in the general population who do not have ovarian cancer. So some of these are fatigue, indigestion, back pain, pain with intercourse, constipation, and menstrual irregularities. Ovarian cancer may be suspected when the symptoms occur frequently, approximately 12 times in a month, are persistent over the course of 2 or more weeks, are unusual, and are unexplained by other causes. So this is a gynecologic cancer symptoms diary. It is found at the CDC website. The URL for it is at the bottom of the page. It's a good idea to pull this up and print it out. If you're having symptoms, this is a good way to keep track of them. This is for all gynecologic cancers, but if you'll notice, ovarian cancer is on this sheet. So if you keep this symptom diary, if you're having some symptoms, this can record how often you're having them, which symptoms you're having, and for how long. You can take this diary to your doctor and show it to the doctor. It's a good way to record all of this. So one question everybody has is, what tests are done to detect ovarian cancer? Well, as we mentioned, there is no screening test for ovarian cancer. However, when ovarian cancer is suspected, here are a few tests and procedures that can be done that can help to diagnose the disease. The following are typically performed when a woman has symptoms of ovarian cancer: a pelvic and rectal examination, also called bimanual examination, transvaginal or pelvic ultrasound, and or a CT scan. And last but not least, when those two, one or the other of those two, and possibly indicate ovarian cancer, the next step would be to do a CA-125 blood test. And that would be if there's an irregularity found in the above exams or if the patient is symptomatic. So this is a really important point. If ovarian cancer is suspected by your doctor, it's very important that you be referred to a gynecologic oncologist. A gynecologic oncologist is a specialist. They are a gynecologist and they are a surgeon, but they are specialized in cancer surgeries. The studies have shown that patients diagnosed with ovarian cancer generally have a better likelihood of prolonged survival if they are treated by a gynecologic oncologist. So once you've gone through the whole process of diagnosis and you do have a definitive diagnosis of ovarian cancer, please feel free to reach out to Oasis of Southern California or any of the many local and national organizations around the country, because it's very important to reach out to others who are going through the same thing. You aren't alone. Thank you all for watching, and I hope this presentation has been beneficial. If you have any questions for us, please feel free to contact me, Robin, and here's my email address, sunmooney@aol.com. My phone number, 909-725-3459. And this is our address. We have a P.O. box in Riverside, but the best way would be to contact me directly. We also have a website, www.oasisofsocal.com. Thank you.